Hello everyone, welcome to my YouTube channel. So today we are going to learn about bioavailability, which is an important 4-mark question for BDS students. And it is also an important topic to understand. So what is bioavailability? It is the fraction of drug that reaches the systemic circulation. So the drug that reaches the systemic circulation. Fraction of drug that reaches the systemic circulation, that is nothing but the blood vessels which reach the heart from a given dose. So intravenous route of drug, it has 100% bioavailability. Why? Because it is directly entering into the circulation, so it has 100% bioavailability. So for oral route drugs, they pass from gut wall and they reach the portal vein and then from the liver. In this picture it was clearly shown, you can see there, right? It has the gut wall and the portal vein, and from liver it enters the systemic circulation. So it was in a step-by-step process. So it undergoes the first pass metabolism, so there is decrease in the fraction of drug. So the oral route, for oral route of drug administration, we have to count the bioavailability, means the availability of the drug to systemic circulations. So in these steps, how much amount of drug was utilized and enters into the systemic circulation. So this is called the bioavailability. So there are many factors that affects the bioavailability, like physiochemical properties of the drug. So what is the state of drug, whether it is solid, liquid or gas, like that. And route of administration, previously said that the IV route has 100% bioavailability, so we have to count on the oral route. So route of administration, route of drug administration also affects the bioavailability. And the physiochemical properties of the drug and pH and ionization of the drug, it is also very important. And food also interferes in the drug. So some drugs are taken before food, some drugs are taken with food, and some drugs are taken after food, after 2 to 3 hours of food. So the food also affects the bioavailability of the drug. And presence of other drugs and pharmacogenetic factors and area of absorbing surface, whether it is gut wall or stomach wall, intestinal wall, or it is whether it is lung. So the absorbing surface also affects the bioavailability. And the gastrointestinal and other diseases, if the liver is affected, so there is less first pass metabolism and the drug gonna absorb more, so it gonna have more bioavailability, right? So gastrointestinal and other diseases also affects the bioavailability of the drug. So this is a very important concept. So these are the basics. So what is first pass metabolism? You have to understand this. So during the passage of drugs, they get metabolized, and some amount of drug was removed or inactivated before they reach the systemic circulation. In this process, from gut wall, portal vein, liver, and then they enters the systemic circulation, right? In this process they get metabolized and some part is removed and only some part of the drug enters the systemic circulation. So this is called the first pass metabolism. So here some drugs enters the liver and some drug enters the kidneys. So the part that get metabolized and removed, it is called the first pass metabolism. So these results in decreased bioavailability of the drug. For example, lignocaine is the drug where it undergoes first pass metabolism in liver. So there is a lot of first pass metabolism, so there is so much decrease in the percentage of the drug that enters the systemic circulation. So lignocaine, we did not give lignocaine in oral route because there is lot of first pass metabolism and we have to give more amount of drug. So lignocaine is advised intravenously or IM. And isoprenyl, so in gut wall it undergoes metabolization and it results in lot of wastage of the drug. So we choose another route of drug administration. So this is So what happens if there is very high first pass metabolism? As previously said, if the drug undergoes extensive first pass metabolism, we have to give the drug in another route parenterally. For example, IV route. IV route has 100% drug bioavailability. So we choose IV route compared to oral route because of high first pass metabolism. So this is one consequence. And another one is, if the dosage of the drug required for oral administration is more than that given by systemic routes, if it is more when compared to systemic drugs, the oral administration takes more amount of drug, it's common. But if the amount is more greater, if the oral administration is much more greater, so it leads to adverse effects to the patient. So we choose systemic routes, for example nitroglycerin. And these hepatic diseases, as I said previously, these results in decrease in drug metabolism. So if the liver was not working properly, for example we will take, if the liver was not working properly, so the liver does not take more amount of drug. So the drug was taken to the systemic circulation. So we need less amount of drug because there is no first pass metabolism. The liver was not working properly, so there is less amount of drug is needed. So this increases the bioavailability. So for the patients with liver diseases, for hepatic diseases, if the patient has any hepatic diseases, we have to give the patient, the dose of drug should be reduced in those patients, right? Example, propranolol and lignocaine. And enterohepatic cycling, it is nothing but the process from gut wall, portal vein, liver and systemic circulation. So this is called as enterohepatic cycling. So it increases the bioavailability of the drugs. Example, for some drugs, example morphine and doxycycline. In these drugs, this cycling increases the bioavailability of the drug. So this is all about bioavailability, guys. If you like this video, please like and subscribe to my channel.